Hi everyone, Dr. Henry here. I'm here to talk to you about Chapter 3, Exercise Prescription. I consider this chapter to be the heart of this course because this is where we learn to prescribe exercise for ourselves in that individualized program. So we all already know that exercise is good for our health, for just our overall well-being. That's pretty well established. But what you may not realize is that fitness programs, one size does not fit all. They need to be individualized. Our bodies aren't all alike. We have different age groups, different ethnicities, and just different genetic code for each person. So something that works really well for one person might not work for someone else. It also depends on your goals, your fitness goals in life. So this chapter is going to help us to form a personalized cardio program, strength program, and flexibility program. So the first step to becoming more active is to just where are you starting? Find out where you're starting. So it's a great idea to monitor your current physical activity. There are a lot of different kinds of activity trackers, and we will look at some of those specifically. An activity tracker is the first type that we will be talking about. So those work best with just, it says here, straightforward actions like brisk walking or jogging. This is something like a Fitbit, to use a brand name, or a Garmin. Um, Walking, jogging works really well. Something like an elliptical trainer, it may pick up on some and not others, so it doesn't work quite as well. If you do really vigorous exercise, it doesn't work quite as well because you're not going to get as much extra credit for the vigorous exercise as you might think that you deserve. Some of these provide alerts when you're sedentary for too long. My husband has one. If he's been sitting more than 30 minutes or something, I don't know, at his desk, then it tells him to get up and move. And that's great because the current studies, what we're finding in research for the last few years, is that no matter how much you exercise, if you still sit a lot of the hours of the day, it is still detrimental to your health. Some of these also have sleep trackers and heart rate monitors built into them. Of course, you have smartphone apps too. Run Tracker is one that I've used, and those sometimes will sync or link to your activity trackers. You can set goals on these. A lot of them do like plot maybe a route where you walk or run. So these can be pretty high tech. Pedometers are pretty low tech. Those just count the number of steps that you do. They don't do anything else. But sometimes for people who are just getting into a fitness program, like a pedometer is a good start before you are serious enough to want to use something more sophisticated. The accelerometer is just a type of technology that measures gravity and changes in movement. So you get extra credit for going faster. It knows if you're running instead of walking, or if you're running fast instead of jogging slowly. It also measures changes in gravity so that it knows if you're going uphill or up a flight of steps. And so the activity trackers such as Fitbits, Garmin's, and smartphones usually have that accelerometer technology also, whereas a pedometer does not. Now, these are the general recommendations for just any adult to get 10,000 steps per day, saying 10K a day. That's where that comes from. And it seems like most of us are not quite doing that yet. As you can see here, this is the steps per day that would qualify or would define a sedentary lifestyle if you're getting fewer than 5,000 a day. 5,000 to 74.99, low active, and that is where most Americans are falling right now, in that 5,000 to 7,500 range. Men a little bit more than women, but they're both pretty much in that range. And then the somewhat active, 7,500 to 10,000, 10,000 to 12, 499 is active, and then more than 12,500 is highly active. So where are you in this? And it's really good for you to just start out your fitness program finding out, how many steps am I getting a day? It may be surprisingly many. It may be surprisingly few. So think about the disadvantages and advantages of exercising. Readiness for exercise is going to be different for each person. It's individualized also. And if you make a list for you, for yourself, of these are the advantages of getting more active. My health is going to be better. I'm going to sleep better. I'm going to be able to study better. Make that list. And then make a list of the cons or the disadvantages. What are some things that may be a disadvantage? Well, it takes a little bit of time in your day. Um, it might make me sweaty and I have to take an extra shower. Whatever you think the disadvantages are, I don't know what those would be. But that list of disadvantages and advantages, and if the advantages outweigh the disadvantage or the pros outweigh the cons, that is probably going to mean that you're more ready to start a program. And the higher you score if you do this activity that's in the book here, the more likely you are to succeed in your exercise program. Now, we have a lot of guidelines that cover exercise prescriptions for cardiovascular endurance and for muscular fitness and for flexibility. And we learned all those terms already in a previous chapter. So these are the guidelines, and they come from the American College of Sports Medicine and from the American Heart Association and from the CDC, the Centers for Disease Control. So all of these organizations in America, in the United States, have come up with these guidelines, and this is what they look like currently. We have what we call a physical activity pyramid. It looks a little bit like the old food guide pyramid. And so what everybody should do, and these are the things at the base of the pyramid, this is accumulating 60 to 90 minutes of moderate intensity activity most days of the week. And this is just yard work. It's just walking, just for ambulation. It doesn't have to be very vigorous activity. It's just what we call lifestyle activity. Then we get a little bit more intentional. And by the way, the things at the base, we can be intentional about those too. Walking places that we might otherwise drive. A big thing in neighborhoods now is walkability. And so from my house, I can walk not only to school, but I can walk to several different stores, a couple of restaurants. I can walk to Trader Joe's and to a lot of different restaurants that are within a 15-minute walk of my house. And this is just your lifestyle physical activity. So building that up as much as you can, walking to the library instead of driving, those help to begin with. Then we become more intentional with our program. The next level is cardiorespiratory endurance, and that is our cardio exercise 20 to 60 minutes, 3 to 5 days a week. And that's just the intentional exercise that you do. Then we have strength and flexibility exercises 2 to 3 days a week. And at the very top of the pyramid, the thing that we need the least of is inactivity. And unfortunately, in the United States, many people get more inactivity than anything else. So that's what we're trying to change here. Okay, let's start with that second level, the cardiorespiratory endurance. It's the single most important one for most of us because it involves our heart. And you know what? We cannot live a very good quality life without a healthy heart. If your heart starts failing at a premature age, your life will not be as good. Now, in old age, people who are, say, in their late 70s, 80s, 90s, strength is a little bit more important than cardio because they're not going to be going anywhere very fast to need really good, extra good heart function. But they get weak, and when it's hard for them to get up out of a chair or to climb a flight of stairs, strength becomes the biggest problem for them. So for really the very old, strength may be more important. But for most of us, cardiorespiratory endurance is the most important. Unfortunately, take a look at these percentage of adults who meet the federal guidelines for aerobic physical activity. And remember what that is from the previous slide. 20 to 60 minutes, and that would be moderate to vigorous exercise 3 to 5 days a week. only 50.4% of men and 42.1% of women. And 34% sadly do not engage in any physical activity that's leisure time, just nothing outside of what they have to do. I love this quote from Plato a lot of years ago in 380 BC. Lack of activity destroys the good condition of every human being, while movement and methodical physical exercise save it and preserve it. Still true today. So aerobic exercise, as well as the lifestyle activity, improve the capacity of our cardiorespiratory system. So we're going to talk about four factors that go into our cardio exercise prescription for aerobic exercise, and aerobic just meaning any exercise that takes extra oxygen. And those four factors are the intensity of the exercise, the mode or the type of exercise, the duration, how long, and the frequency, how often. Now, if you are a person that has certain risks, you should get a medical exam before beginning, especially a vigorous program of exercise. But most college students are fine to begin a program without any kind of medical clearance. So every time we stimulate our cardiorespiratory system, in other words, we're just making the heart pump or beat faster than it's accustomed to. If it's for a 30-minute workout session, we went for a really fast walk or went for a jog or we played tennis, our heart is beating faster than it's accustomed to for that specific period of time. And if we can exercise at 30 to 90% of what we call our heart rate reserve, then that is going to be what will improve our cardiorespiratory fitness or our cardiorespiratory development. So health benefits even start lower than that, 30 to 60% of the heart rate reserve, but we'll get more fit if we'll exercise at 60 to 90% of heart rate reserves. So that vigorous intensity exercise like running, vigorous sports, those give us even more benefit than just the health benefits. Now, what in the world is heart rate reserve? Let's talk about that for a moment. This calculation takes a few steps, but they're pretty easy steps. So try to follow along here. First, we determine our maximal heart rate. That is as fast as your heart would beat if it just could not possibly go any faster. And sometimes we use 220 minus your age, but a better formula for that is this one, 207 minus 0.7 times your age. And so that is your estimated maximal heart rate. Now the heart rate reserve is going to be calculated by that maximal heart rate minus your resting heart rate. Of course, you can just take that by putting two fingers on your carotid pulse in your neck and counting for 60 seconds and see how many beats per minute is your resting pulse. So take your maximum heart rate and then subtract your resting heart rate. Then we're going to say, well, what intensity do I want to train at? So maybe I want to train at an intensity of 50% of my heart rate reserve, or 60%, or 90%. And so you take whatever training intensity you want, 50%, 60%, whatever it is, and multiply that times your heart rate reserve. Then, the very last step is you will add back in, and you see this in the last line here, you will add back in your resting heart rate at the end. And this seems complicated, but it's not. In your textbook, under the intensity section, there's a very good example of calculating intensities for a 20-year-old person, which is pretty close to the age of you guys, for most of you, and it gives you examples there of how to calculate that. So personalize that to you and calculate your training zone for your exercise intensity. Now, what is the difference in moderate and intensity exercise? Moderate intensity exercise is like walking, something that is around the 50, 40, 30, all the way up to 60% of your heart rate reserve. And those exercises will definitely improve your health and they will improve your fitness some. But vigorous intensity exercise, of course, improves our fitness level even more and our health also. Now, back in the 1990s, when I first started teaching exercise science, the guidelines switched from telling people to do vigorous intensity exercise to moderate intensity. And the reason that switched is because some people are intimidated by thinking about doing vigorous exercise. They go, I just can't run. I can't do it that much. So it's a little bit more appealing to people. And so that is one of the main reasons. As you see here, moderate intensity training, it does have health benefits, even though you don't get as fit. And a lot of those risk factors for cardiovascular disease or death by cardiovascular disease go down with that moderate intensity exercise. So that's a really good place to start. And for some people, they stay there their whole life. However, vigorous intensity types of exercise are going to give you a higher VO2 max, which is just your maximum oxygen consumption. It's going to improve your risk factors for heart disease even more, so even more health effects. So now the pendulum now in recommendations is starting to swing back to vigorous intensity exercise because we know how good it is for people. But moderate intensity exercise definitely has a place, and for some people, they can do that their whole life and be a healthy person. So, a lot of us do like to monitor our heart rate when we're doing cardio exercise, especially when we first get started. So, monitoring your heart rate, you don't want to stop exercise and then take your heart rate for a whole minute because it goes down over the course of a whole minute after you stop exercising. So, the best thing is to count your pulse for 10 seconds and then multiply by 6, which would equal 60, to get your pulse rate in beats per minute. And it's good at first to measure that right when you've been maybe exercising aerobically for about 5 minutes. Just stop and take that heart rate and see if you're in the range where you want to be in. For people who are older, which most of you guys aren't, and for people who are very deconditioned, which some of you could be, cardiorespiratory training may need to start at about the 50% rate. You may not want to have much higher than 50% of your heart rate reserve in the beginning, but then you can work up to the 60%, 70%, or even 80 or 90% of your heart rate reserve. So that is our discussion on intensity of exercise. The next component is the type or the mode of exercise. And when we're doing cardio exercise, the main things, it just has to be aerobic. It has to use extra oxygen. So in order to do that, you have to use major muscle groups. That means your big muscles, your legs, your arms, legs primarily. You can do aerobic exercise with only the arms. It's just a little more difficult. Just moving your fingers or toes is not going to give you aerobic benefits. So beyond that, you can choose it based on your personal preferences. You may walk, you may run, you may play racquetball, and your book has listed many, many different types of aerobic exercise. Some of them are sports, some of them are totally non-competitive. Just whatever your personal preferences are. It doesn't have to be the same thing every day. You can mix it up. But remember that you get good health benefits at the lower end of that cardiorespiratory zone, around the 50% mark. But you're going to see greater improvements in your aerobic capacity or your VO2 max at the higher end, like 80 and 90% of your heart rate reserve. So you may want to choose 3 days of activity that are very vigorous at the high end of your zone, and then maybe you want to choose 2 or 3 days that are at the lower end of your zone. That's a good, well-rounded program. Next is the so recommended is between 20 and 60 minutes per session. So if you're doing vigorous intensity exercise like running all the time, it just doesn't take as much to get the job done because you're doing more for your heart every single time you go out and exercise. So 75 minutes a week is probably enough if you're doing something really vigorous. If you're doing something more moderate like walking, and there are lots of other moderate exercises, walking is just a good example, then 150 minutes a week. It's going to take a lot more just to get the same type of benefits. So kind of the same thing here. If you're going at 90% intensity, like a pretty vigorous run, 20 to 30 minutes is a pretty good workout. But if you're going at 50% intensity, like a moderate paced walk, then it's going to take more like 60 minutes to get a very good workout in that day. However, even if you're just doing moderate intensity exercise, accumulating at 30 minutes during the day, so 10 minutes 3 times a day would even work. That's still a benefit. You're not going to be a super fit person doing that, but it's still a benefit to the health. So it's worth doing even if that's where you need to start. So 5 hours of moderate activity, or 2.5 hours per week, if you're doing vigorous activity, of course those give us additional benefits. So again, a little is good, more is better, a lot is even better still, to a point. If you get so much that you're getting burned out or injured, then that's too much exercise. You don't want to have injuries, especially in the very beginning of your program. If you do too much too soon, you get either burned out really quickly or you can get injured, and you don't want to do that. We always want to warm up for 5 to 10 minutes, which is just a lower paced cardio workout, like a slower walk or a slower jog for the first 5 to 10 minutes. And then we want to do the same thing at the end. Keep moving, but just at a slower pace for the last 10 minutes to cool your body down. So it says here, general exercises at lower intensity than what your actual target zone is. And that cool down is really important because it helps your body just come back down to resting levels more slowly. And then after your cool down is over, is a good time to do some stretching, some relaxation activities. We'll talk about stretching after a while. So last but not least is the frequency of exercise, and the recommended frequency is 3 to 5 days per week. If you're doing vigorous intensity, like running pretty hard, then 3 sessions a week, hopefully on non-consecutive days, that's a pretty good fitness program. If you're doing moderate intensity exercise such as walking, it's going to take more like 30 to 60 minutes, and it will take more than 3 days a week to see very much improvement. You can still help your health and your heart, but it's going to take more than that to see improvement. So a little bit longer exercise sessions and more than 3 days per week, and that's the maybe 4 to 5 days per week for those folks. Now, if you're trying to lose weight, and we have a whole chapter on weight loss, so I won't do much here, but it takes more for calorie burning for weight loss. So it's going to be more like 60 to 90 minutes, and this says most days of the week, so I would say maybe even 6 days a week, still giving yourself 1 day off. Now, like I said before, people who have a desk job or something where they sit most of the day, they can really, even though they maybe exercise every morning for 30 or 45 minutes, they can cancel out a lot of those benefits just by sitting for the rest of the day. So those who spend most of their day sitting have the highest death rates. So just if you have a desk job or a job where you have to sit, just get up and walk for a few minutes every hour. Not when you're asleep at night, but every waking hour. And college classes are great for that because you have a break, after every class period, and you walk 10 minutes to your next class, so that works really well. In the real world of, adult life, after you get out of college, sometimes that's harder, and you can find yourself sitting at a desk for several hours and realize you haven't gotten up yet. So just avoid that. Activities that enhance our daily non-exercise activity thermogenesis, and this is an acronym, NEAT. The daily non-exercise activity thermogenesis is just boosting your metabolism through moving throughout the day. Not formal exercise, just getting up and walking a couple of flights of stairs, or walking over to get you could get a snack over across campus or across the building from where you work, instead of just staying where you are all the time. So these are just some kind of suggestions. Take a look at them. I've found that walking rather than driving short distances is so good, and that's where the walkable neighborhoods come in. Um, that really does help. So just see which one of these that you could implement in your life. Here's another few on the list. Okay, so volume of exercise is one thing that we need to talk about. Volume is it is the combination of, or the product of, frequency, intensity, and duration. So if you multiply all three of those together, and what we want to be doing is seeing on energy expenditure, that means a calorie expenditure of 1,000 calories per week in exercise. And that is the other way to say that volume is 10,000 or more steps per day. So the volume for vigorous intensity aerobic exercise, 75 minutes, 3 non-consecutive days, will give you the correct volume. For moderate intensity exercise, 30 minutes, 2 additional days work. So 4 to 5 days, 30 minutes of moderate intensity. And those will give you that 1,000 calories a week that is going to be helpful. Progression just says, how do we improve? How do we progress through our program? So you start out doing what you can do. And we don't want to have muscle or skeletal injuries from exercising too hard, too much, too soon. So maybe only 3 training sessions, 15 to 20 minutes here it says per week, and then we start increasing. When I started running, I could only run a little over a mile at a time. I'd been a runner in high school, but then when I started running again at about age 40, I could only run a mile or so to start, and I try to increase that by about 5 to 10 minutes every week until I was up to just a regular 3 miles, and that worked very well. So progressively increasing both the frequency and the duration, which is what I was increasing, and the intensity, just going a little faster until you reach your fitness goal. That's the way to progress. Now let's move away from aerobic exercise for a while and talk about muscular fitness. So muscular strength and endurance, as we've already learned, are the components of fitness that lend themselves to muscular fitness. And so we know that when we do strength training, that we will be able to exert more force. We also know that when we are sedentary and don't do anything with our muscles, the muscles atrophy. That means they just kind of shrivel away. And that can be because your leg was in a cast, or it can be because you started a sedentary desk job, or just because you just kind of got lazy in your free time and prefer to watch TV instead of getting out and moving. But when they are not challenged on a regular basis, we see muscle atrophy. And you see here the myofibrillar hypertrophy. This is a type of muscle atrophy, and we will not go into those in detail. And the sarcoplasmic hypertrophy. This is when the muscles get greater in size because you are working out. So hypertrophy is what we desire. We want our muscles to get more toned and larger. And muscular strength is primarily dependent on how dense our muscle fibers are and also how many of them there are. Unfortunately, about 3/4 of us do not do any type of muscular fitness activity. Even people who will walk or do something moderate in a cardio program do not see the need for doing anything with strength training, and this is really sad. It's a mistake. So we have a couple of principles here. We have the overload principle, which just says to overload your muscles systematically and progressively. So if I start out with a certain weight that I'm lifting, that challenges my muscles, maybe by next week or 2 weeks from now, I can add a little bit of weight. That's overloading the muscle a little bit more. And I'm going to do it at a fairly slow rate where I add just a little bit each week, or a little bit more weight, a little bit more reps, maybe one more day per week. So we overload by adding frequency or intensity or duration. Now, specificity of training is a principle that's really fairly simple, and it says the training program must be specific to obtain the desired effects of muscle strength or endurance. And this is kind of a no-brainer when you think about it, because if you're going to run a marathon, you have to do a lot of long-distance training. Just a little bit of sprinting is not going to get the job done. That is specificity of training. It goes the same for muscular fitness. Anything I'm doing with my muscles, if I want to increase muscles in a certain part of my body, I'm going to have to work out those muscles. If I'm going to increase my muscular fitness for a certain sport that I want to play, I have to mimic the movements in that sport in my muscular training program in order to get better. Periodization is just a way of increasing your muscular strength by altering variables, how much you're lifting, number of reps, number of sets. And the book does a very good job of explaining these in the chapter. So I invite you to read that on periodization if you're interested in it, but it is a little bit beyond the scope of this lecture, what we want to take time to go into. We also have modes of training for our strength, and there's some terms I want you to understand. Isometric is a contraction when you are really not, where the joint or the muscle is not moving at all. A plank is a good example of an isometric exercise. You're just holding the plank, and nothing is really moving, at least not very much, but it's still creating some strength. And so isometric, the joint angle is not changing, no joints are moving, you're very still, but it's really, really still beneficial. And programs, exercise for the lower back has a lot of isometric training in it. Dynamic is when you do a muscle contraction and it does produce movement. And most of us, dynamic is most of our strength training program. And so you can do dynamic movement without weights at all, like push-ups and sit-ups. You can do it with free weights, which is just some barbells or dumbbells. You can use fixed or variable resistance machines in the weight room, or you can use isokinetic machines, which are a little bit more sophisticated. You have two phases in those lifts. The concentric phase is the positive resistance, and if I were doing a dumbbell curl, that would be the lifting phase. And the eccentric phase is the negative resistance or the lowering phase of my dumbbell curl. People ask me sometimes, are free weights better or are machines better? It is totally up to you. Free weights, of course, are a lot cheaper, maybe a little bit more accessible. But for people who are beginners, many times machine weights are easier to use. So that is just depending on what you want to do with your program and what you have access to. Other popular types of training are exercises on the stability ball, like crunches, or different isometric or dynamic exercises on a stability ball, or band resistance. So those can be done with very little expensive equipment at all. So really good for stretching the fitness budget. Now, we have to have intensity, time, and frequency for strength training, just like we did for aerobic training. So the intensity would be equal to the resistance in strength training. So how much you're lifting, that's the intensity of your workout. So recommended for developing strength is 80% of your maximum capacity. 80% of what you could lift if you were just lifting one repetition. Commonly prescribed is 8 to 12 repetitions for improving strength, and you're going to increase that resistance or that amount of weight, of course, over a period of time. Now the time is how many sets you do, and most people do 1 to 3 sets, rest a little between each one. You can do a lot of good even with just one set of weight training, but of course 2 to 3 sets will give you some additional benefits. The frequency that's recommended for strength training is 2 to 3 times per week. And I will say that if you're going to do more than 2 to 3 times per week, alternating the muscle groups so that you're not working out the same muscle group several days in a row is a good idea. And the volume, just like for cardio exercise, is the sum of all repetitions multiplied by the resistances used. And people who are really serious about weight training may calculate volumes. Most of us do not. And then, of course, we progress through adding strength, adding resistance, adding weight to our exercises, or adding time to our workouts, or adding more days per week. And these are the strength training guidelines for general fitness, which is the one that I've just pretty much explained to you. And then for muscular endurance, and you learned the difference previously in the difference in muscular endurance and muscular strength, where in muscular endurance it has to do more with exercising repeatedly, but not with maximal resistance, not with real heavy weights, but doing a lot of repetitions. And maximal strength is just how much can you lift if you're just going to lift it for 1 or 2 times. Bodybuilders have a totally different program. And so not many of you are going to be bodybuilders, but you'll see how theirs is different. For muscular endurance, more reps is good, but less weight. So you're going to lift lighter weights, but more repetitions. For strength building, you're going to lift heavier weight and fewer repetitions. And like we talked about in the previous slide, just for general fitness, a combination of endurance and strength, 8 to 12 repetitions is a very good place to start, with 2 or 3 minutes of rest between sets. And 2 to 3 days a week is fine for everyone except for the bodybuilders. And there are strength training programs in Appendix A. There are also pictures of exercises in your textbook. So you have a lot of ideas to get you started. So these are strength training guidelines. Just take a look at these. I don't need to read them to you. The next to last one I like to emphasize, maintain proper body balance. Just good posture while you're lifting is always something that is good to remember and that beginners sometimes have a hard time with. So that's why we want to use lighter weights at first until we get into the habit of very good posture and form before we add too much weight. And this is the rest of that list. The third one here, holding your breath while lifting a weight, is a typical issue with beginners. They tend to want to hold the breath, so just make sure you keep breathing. A lot of people will say to exhale on exertion, like the lifting phase, to exhale. That's pretty good advice, but the main thing is just to keep breathing. Okay, let's talk about core strength training, because you hear a lot about the core. And core is what makes our posture possible. It gives us good posture. And if we have a good, strong core, it does make everything we do in life a little bit easier. It definitely makes every sport that I can think of easier to perform. You're going to have better performance there. And last but definitely not least, it helps with a lower back pain. And so many people have lower back pain at some time in their lives, but this is really an important one. If we do some core strength training, it's going to make our posture more stable, and it's going to improve our dynamic balance. And that means just our balance when we're moving. So if you're walking along the sidewalk and you trip over a crack in the sidewalk or something that you didn't see in your path, you're more likely to be able to retain your balance instead of just falling and doing a face plant. So that dynamic balance is very important. And dynamic just means while you're moving. So as you are developing your own strength training programs, just remember what your current level of fitness is, how much time you realistically want to devote to your workout. Don't you try to be realistic in this, and then go from there. Try to do the 2 to 3 days per week. For some people, they're going to say, I just need to start with 2 days and I can only devote 20 minutes to this. And that is okay. You can start there and still do a good bit of good. Here we have dietary recommendations for strength training. We have a whole chapter on nutrition in chapter 5, but this is just a general recommendation that people who do a lot of strength training need to increase their protein intake a little bit, and you see the recommendation here. And some extra recommendations for that you can find in your textbook. And last but not least is flexibility is the last component of our fitness. We've talked about cardio fitness and about muscular strength and muscular endurance. Flexibility, improving and maintaining good joint range of motion. And that's what flexibility is. And I think it's one of the most often ignored components of physical fitness because people don't think stretching is all that exciting. But it does really help our quality of life, and especially as we get older. The more we sit, the more we're sedentary, the stiffer we become, and that happens kind of naturally as we get older. But as we get older, we're also more sedentary. That's kind of the double dose of stiffness. So we want to keep moving throughout our life. So flexibility exercise is just stretching to improve that range of motion. And you can do those any time, but following the aerobic workout is a real good time to do it because your muscles are warmed up already. The blood is flowing to them very well, and that's just a good time to increase your flexibility. So if you're trying to start a flexibility program, you have to remember that, including all the body parts. So flexibility is very joint specific. That means you can stretch, you can touch your toes 20 times a day, and it does some good things for your hamstring and lower back flexibility, but it doesn't do anything for your shoulders. So you need to include all your body parts, stretch every major muscle group. Excuse me, I did not mean to advance that slide. The muscles surrounding each joint in your body, around the knee, around the hip, around the elbow, around the wrist. What we do is we stretch them, and here's the overload principle again, a little bit beyond what they're accustomed to. We don't want pain. Stretching to the point of pain is not a good idea, but what we do want is to stretch them a little bit beyond their comfort zone. And so the mode and the intensity and the repetitions and the frequency of exercise, just like we applied to strength and cardio, we apply those to flexibility programs as well. So the frequency should be 2 to 3 days a week, just like our strength training. Daily is most effective. It's hard to stretch too much. You could stretch every day and you would not hurt yourself. Intensity, just to the point of tightness, or mild, this is mind, but that's not correct, mild discomfort. So a little bit of tightness, mild discomfort, but not pain. Holding each stretch 10 to 30 seconds, and do each stretch 2 to 4 times. We have static stretching, dynamic stretching, proprioceptive neuromuscular facilitation stretching. Those are all types of stretching, and they are all effective in different ways. And then we want, it says a target of 67 seconds total. So if you do 3 stretches and hold them for 20 seconds each, that would be a total of 60 seconds. Back to type, a static is a stationary stretch. It's just stretch and hold, and it's definitely the safest type of stretch. A dynamic stretch is a moving stretch, and those are great for some sport specific skills, but we need to be very careful with dynamic stretching because it's very easy to overstretch a muscle. And then PNF, or proprioceptive neuromuscular facilitation stretching, is a kind that uses kind of a stretch and relax system, and you really, really can do some very good some very good progress with your flexibility with the PNF stretching, contract and relax method, and this is described in the book also, and this is a really good thing for you to try out. It's easier with a partner for most muscle groups of the body. Now this is pattern or when. uh, Flexibility exercises, as I said before, when the muscles are warmed up, like after your cardio exercise, that's probably the best time to do it, just because you already warmed up. But you can stretch at any time. But if you're stretching when the muscles are cold, just take a little bit more caution and be just more careful and not overstretching. For some activities, very gentle stretching is recommended. With your warm-up. So again, 3 to 5 minute warm-up and 10-minute warm-up before your stop and go activities if you're doing a sport or something that takes a lot of stopping and going. So I like stretching with a warm-up, but it's not necessary. In the old days, they said that stretching before exercise prevented injuries. The research that has been done on that has not really found that to be the case, so that's not really strongly recommended anymore. But stretching before exercise is fine to do. Just take caution when your muscles are not warm yet. After aerobic exercise, of course, is always a good time. So going all the way through the body, each major muscle group gets at least one stretching exercise. And again, you have the appendices in the back of your book that show those exercises. And it's fine to do more than one exercise for each muscle group, but at least one for each major muscle group. You know, like the chest, the back, the triceps, the biceps, the hamstrings, the quads, the shins, the abs. So every muscle group in your body needs to have at least one exercise that will target that muscle group. And you always want to perform each stretch through the joint's full range of motion, which means, of course, we stretch far enough that we feel a little bit of discomfort or a little bit of challenge, but not actual pain. And you can do a full stretching workout in 15 to 30 minutes without any problem at all. Now, there are some that could cause injury, especially when you get to the ballistic stretches, when you're doing a really bouncing stretch. Again, those are detailed a little bit more in the chapter 3 in your book. So you just want to take caution with those exercises. And then there are some also that are contraindicated, which means just be careful about those. And there are several stretches that you need to really be careful with. And those are also described and pictured in the appendix in the back of your book. So take a look at those for sure. Now, while we talk about flexibility, we have to talk a little bit about low back pain. And this is the end of this chapter, but just something that we need to talk about, because a lack of flexibility is one of the greatest causes of low back pain. And so many people have low back pain at some point in their lives. 60 to 80% at some point in your life will have an episode of low back pain. And some of the causes you see listed here: physical inactivity, excessive body weight, someone with a great big stomach, it kind of pulls their spine out of alignment, makes them have a little sway back that kind of causes that low back pain. Strain and sprain injury, you may, people say they, quote, pull their back out. That's a strain or a sprain. Stress can actually cause low back pain. And then just those poor posture habits that we often get into just from sitting in the same position too long. So all of these, or a combination of them, could cause you low back pain. So if we have good posture, it not only makes us look better, it makes our lungs work better because we can get a deeper breath because we've got just more space to breathe. better self-image. It just gives us more confidence. So good posture is really worth working on. And there are a lot of exercises, especially I'm a yoga teacher, and in yoga we do a lot of chest openers, which means those are posture exercises. And so many times we sit at a desk whether it's a school desk or a desk at work all day, and we kind of tend to round our back and hunch our shoulders and have that sunken chest going on. And doing exercises that open the chest and um, bring those shoulders back and down away from your ears. Those are very good at improving our body posture. And so a lot of the Pilates and yoga exercises are very, very good for improving our posture. So you see several little clips in your book about body mechanics and even some tips about how to work at a desk and have good posture at the desk. And also a little section in the book on text neck, which is just, so many people text so much now that you're looking down, and that's called um, spinal flexion in your neck. And it makes your neck hurt after a while. So that just that angle that your neck has to be at to text. So it gives you some good suggestions for avoiding text neck. So please take a look at those. Bacterial infection. Now, some back pain could actually be a medical problem from an infection, and so if you experience any of these symptoms with your back pain, then that might be time to see a doctor and get that checked out. This just shows the incorrect and correct pelvic alignment. Your pelvis is that bone under your rib cage there, and the person in the left is doing what we call a forward pelvic tilt, and that makes your stomach stick out and your lower back stick in, and it does some really unkind things just to your spinal muscles in your back, pulling them out of alignment, and that will make your back hurt after a while. And this right person has got the good pelvic alignment where you can drop a plumb line from your earlobe to your shoulders, to your hips, to your knees, to your ankles, and that should go straight down all the way from the earlobes to the ankles, and that is your correct pelvic alignment. So if there's not disease or injury, so if it's just regular back pain caused by posture or sitting too long, then the things that will help to reduce that back pain is aerobic exercise, because you're just up and moving, muscular flexibility exercise, because you are stretching your lower back. Remember, stiffness is one of the main causes of low back pain. And then those muscular fitness exercises targeting the core. Remember, the core just being your midsection, and the ab and the back muscles. And again, those are detailed in the back of the book. So there's a phrase, exercise as medicine, and exercise can be medicine. It can help us get healthier, but it has to be the right kind of exercise. So there are exercises. If you do contraindicated exercises or too much of a good thing, then that may hurt you more than it helps you. So this just gives you treatment options for low back pain. Exercise therapy or even physical therapy sometimes is needed for strengthening the muscles, and those postural muscles particularly. Just reducing tightness by stretching. We see that there. And core strengthening, because it makes our core stronger and our back muscles have less stress pulling on them. And again, appendix in the back of your book has some kind of backache syndrome exercises. But again, if you've got real back pain, I would see a doctor before just prescribing exercises for yourself. Those are very good exercises pictured in your book. But if you've got a back problem that is really a medical issue, that needs to be checked out by your physician and not just self-diagnosed and self-prescribed. So let's just wrap this chapter up. if you're going to add exercise to your life and you've never done it before, or maybe you have done it, you're going to add some more types of exercise. It's going to require some modification of your behavior. And most of us have to have some motivation to make that happen. So you need to remember, if you enjoy an activity, you're going to be more likely to do it. If you decide to take up an activity, like say, I'm going to start running because I know I need to start running, but I hate running. Don't do that. Don't do that to yourself. You need to find something that you enjoy, and maybe someday you will enjoy running, but the first few weeks of a program are the hardest and the easiest time to drop out. So try to do something that you enjoy. Keeping an exercise log, which we will be doing in this class starting in a couple of weeks. A very good way of kind of motivating yourself and having a record of your activities every day. Knowing before you even start that it's going to take some time and some dedication. So be realistic when you set your goals. You guys are going to be writing up your own program in a couple of weeks, and be realistic. Set some goals that you can actually measure. Be able to monitor your progress. We've done fitness testing already. We'll do it again at the end of the semester, and that's going to monitor our progress. And then don't be afraid to make adjustments to your program as you need to. Nobody has the perfect program from day one, and most of us need to adjust our program anyway as we progress and as we get more fit. So don't be afraid to make adjustments. Just know that this is for you to have a better life, and getting some good exercise habits is one of the best things you can get out of this class. So hope this will help you get started, and in the next chapter we'll start looking at different types of activities to give you some good ideas there. Thank you for listening.